Hello there. Today let's have a friendly chat about something called diabetes mellitus, or just diabetes for short. It might sound complicated, but we can break it down together. Think of your body as a car and the food you eat as its fuel. To use that fuel properly, your body needs a special key called insulin. Insulin helps move sugar or glucose from your blood into your cells, where it's used for energy. With diabetes, there's a problem with this key. Either not enough insulin, or the insulin that is made doesn't work properly. That makes sugar build up in your blood, which over time can cause health problems. Understanding diabetes helps families and communities support each other. Diabetes is common worldwide. It can affect everyone, young and old. The good news, with information and support, people with diabetes can live full, healthy lives. There are different types. The two most common are type 1 and type 2. We'll explore them next. Key takeaway: diabetes means your body struggles to control blood sugar, but it can be managed. One tricky thing about diabetes, especially type 2, is that symptoms can be subtle at first. They can creep up so slowly you might not notice. A common sign is constant thirst that water can't quench. Excess blood sugar pulls fluid from tissues, causing dehydration. You may also pee more often, even waking at night. Another key sign is deep, persistent tiredness. Cells can't use glucose for energy, so your body feels starved despite eating. You might notice unexplained weight or muscle loss. Blurred vision can occur as lenses swell from high blood sugar. Often this prompts people to see a doctor and improves when sugar is controlled. Cuts and sores that take longer to heal are another warning sign. High sugar affects circulation and nerves, increasing infection risk. Tingling, numbness, or pain in hands or feet can signal neuropathy. You may also feel unusually hungry as your cells crave energy. If you notice any of these signs, talk to a doctor. A simple blood test can help. A quick blood test is all it takes to find out what's going on. Early detection makes management simpler. Support from family and healthcare professionals matters. So, what causes diabetes? Let's break down the two main types. Type 1 is an autoimmune condition where the body mistakenly destroys insulin-producing cells. Triggers may include genetics and environmental factors. It is not caused by diet. People with type 1 need daily insulin via injections or a pump and lifelong management. Type 2 causes about 90% of cases. The problem is twofold. Not enough insulin production, and cells can become insulin resistant, like a rusty lock and key. Risk comes from genetics and lifestyle. Weight, inactivity, and age increase risk. Good news: type 2 can often be prevented or delayed with healthier lifestyle changes. Small, consistent changes, activity, and better food choices make a big difference. Both types require monitoring and a plan to balance insulin, food, and activity. Regular checkups and support keep complications at bay. It is understandable to feel worried, but with care and support, people with diabetes thrive. When you have diabetes, the food you eat plays a massive role in managing your health. It's like being the captain of your ship. You decide what to load on board. Your best friends are high-fiber foods, lean protein, and healthy fats. Broccoli, spinach, kale, bell peppers, mushrooms, all low in carbs and packed with nutrients. Soluble fiber examples: oats, barley, nuts and seeds like almonds and chia halt sharp spikes. Legumes, chickpeas, kidney beans, lentils give steady energy. Include lean protein at every meal: chicken, turkey, fish, eggs, or tofu. Oily fish like salmon help protect heart health. Healthy fats: avocado, nuts, olive oil improve blood sugar control and satiety. Choose whole fruits like berries, apples, and pears rather than fruit juice. Pair fruit with protein or fat, for example, apple with peanut butter. Some foods are allies, others make management harder. Watch refined carbs, unhealthy fats, and added sugars. They spike blood sugar quickly. Biggest to avoid: sugary drinks. Soda, sweet iced tea, sugary juices, and energy drinks. They are liquid sugar, immediate spikes, and little nutrition. Choose water, unsweetened tea, or black coffee instead. Foods made with refined white flour, white bread, pasta, pastries, and many cereals digest quickly. Think of whole grains as a slow-burning log, refined carbs as paper that burns fast. Opt for whole grain versions of bread, pasta, and rice. Limit processed snacks like crisps, biscuits, and cakes, often full of sugar, trans fats, and sodium. Check labels for trans fats and high sodium. Both are harmful to heart health. Better swaps: a small handful of nuts, plain yogurt with berries, or veg sticks with hummus. Fast food can be very high in calories, unhealthy fats, salt, and hidden sugars. Large portions, fried dishes, creamy sauces, and sweet curries can spike glucose and calories. Choose grilled over fried, ask for sauces on the side, and load up on steamed veg or salad. Reading food labels is powerful. Watch for hidden sugar, trans fats, and sodium. You don't need to completely avoid treats. Small portions and balance are key. Be mindful. Enjoy everything in moderation and make smarter swaps when you can. Theory is one thing. How does this work in real life? Instead of grabbing your usual white loaf, pause and compare labels. Choose whole grain. Skip sugary cereals. Pick plain porridge oats or no added sugar muesli. Small swaps done every week add up to better blood sugar control over time. It's progress, not perfection. For lunch, bringing a homemade lunch is often better than a pre-made sandwich on white bread. Make a colorful salad with leafy greens, cucumber, tomatoes, peppers, and lean protein like grilled chicken or tuna. Use olive oil and lemon juice for dressing, simple and stable for blood sugar. When eating out, ask how dishes are prepared and request sauces on the side. Choose tomato-based sauces, grilled fish, and vegetable sides where possible. Keep desk snacks like unsalted nuts, apples, or plain Greek yogurt handy. If offered cake, enjoy a very small slice and savor it. Ensure your previous meal was balanced. Balance matters across the day. Life is for living. Make mindful choices that let you enjoy meals and social time. Living with diabetes or taking steps to prevent it is a journey, not a destination. It's about daily self-care and small actions like a brisk walk. You are not alone. Doctors, diabetes nurses, and dietitians can guide you. Family and friends can join you for walks or help cook healthy meals. Find activities you enjoy: walking, cycling, dancing, or gentle gardening. Consistency matters most. Exercise helps insulin work better, boosts mood, and supports heart health. Daily habits like planning meals and taking a walk are positive steps toward vitality. Be kind to yourself on imperfect days. Each new meal or walk is a fresh opportunity. You've got this. Small, consistent choices add up to a healthier life. If you found this helpful, please like, share, and subscribe. Tap subscribe and the bell so you won't miss future health guides from Happy Health 10. Thanks for watching. Take care and see you next time.